This program is brought to you by Ignite TV. Now you're in command. Visit Rogers.com for more details.
And by 5. Hi, and welcome to HealthLink. I'm David Shearman. Your regular host, Carol Martin, isn't available because she has no voice. So that means that I'm the B team, and it's a pleasure to welcome you as a viewer to HealthLink, which is a program which connects home, community, and healthcare. Now, my guests today are Gillian Jordan, who is a program manager at the Health Unit, and her responsibility is infectious diseases and the infectious diseases program, and Mayuri Chaudhari, who is another program manager at the Health Unit, who is responsible for vaccine preventable diseases. And lest we think otherwise, these are very big and important programs that are a part of our Health Unit's portfolio. We don't hear a lot about them, but I happen to know they are very important. And we're going to be talking about something called RSV, and I'm not even going to try and pronounce it because when I tried it once and I made a mash of it. So, Gillian, what is RSV?
Sure. So RSV is respiratory syncytial virus. It is a common respiratory illness that causes cold-like symptoms. So are things like cough, runny nose, sore throat, and fever. And like our other respiratory illnesses, COVID-19, influenza, it spreads from person to person through virus droplets in our coughs and sneezes from an infected person. RSV follows a seasonal pattern, so we don't hear much about it in the spring and summertime, but it tends to pick up in the fall, peaking in the winter. And actually, in reviewing the most recent provincial reports on RSV circulation, it looks like here in Ontario, that activity did peak in December. And though it is coming back down a bit slightly, we're still seeing it circulate here locally.
So how do you who tracks this and how does this get tracked?
Yeah, so RSV, like COVID, is something that we can test for through a respiratory swab. So if you're someone that's experiencing respiratory symptoms, so again, cough, cold, fever, and your physician is concerned, they can do a test that's then submitted. And unlike COVID, where the health unit gets each and every report back to know that people in the community have it, it's reported back to your own physician, more for a management perspective. So when reporting on numbers, we're able to speak at the provincial level, not so much necessarily locally. However, in the last few months, we have seen at least one outbreak of RSV at a local retirement home, as well as we often get calls from parents or members of the community that are concerned that have got one of these positive results back and are wondering what they should be doing. So yeah, it's definitely out there.
Well, who is the most affected by RSV? It sounds like there's almost two ends of the spectrum, age-wise at least.
Yeah, so I think when we talk about RSV, we more commonly hear children and infants as those who are at higher risk of severe infection. For the general public, usually we'll be able to recover well at home with our general pain management, rest, hydration. However, we also know that older adults are at increased risk of those severe complications, especially those with pre-existing heart conditions, lung disease, or just general weakened immune system. This is especially true because RSV acts on our lungs. So if someone has asthma or COPD, it really has a chance of making those things worse. It can lead to things like pneumonia and bronchiolitis. So yeah, those who are older are definitely at risk of those severe complications, as well as just maybe taking a bit longer to clear the infection in general.
Mm-hmm. And what about infants? I recall them also being a major concern as well.
Yeah, so interesting thing about RSV is I think upwards of 90% of infants, so those 2 years of age and younger, will be infected with RSV. So it's very transmissible, especially in our younger ages, which is why we hear so much about it in places like childcare centers. And again, because it acts on the lungs, when we have tiny people that are still developing, it can also lead to, more severe complications, just like it can in older adults.
At what point should someone seek treatment for RSV?
So, as I mentioned, especially folks who are older, the infection may take longer to clear. And though antibiotics aren't available, if you're finding it's taking quite a long time to clear that infection, you can seek care from your healthcare provider, and they might be able to provide things like hydration or assistance with pain management or other medications that can help with your breathing. However, if people are getting to a point where they're really struggling to breathe, so wheezing, maybe seeing a bluish tint in the skin, getting really shortness of breath, that's something that requires quite urgent medical attention. So over and above seeing your regular healthcare provider.
Sure. That means a trip to the ER.
Yeah, for sure.
Yeah. And they're all obviously qualified to diagnose properly and determine exactly what's going on.
Yes, absolutely.
And lest we think that our ERs are overcrowded, they're busy, but that's what they're there for.
Yeah, absolutely. And not being able to breathe is very much a medical emergency. So I would think that if any of those things are happening to you, don't delay getting care and head up there right away.
Sure. Now, is there any way you can prevent getting RSV aside from vaccinations, which we're going to talk about in a moment?
Yeah, so lots of the things that we've been hearing about over the last 3 years throughout the pandemic work for RSV as well. So those are things like washing your hands, especially before you're touching your eyes, nose, and mouth. Perhaps you'll be wearing a mask in crowded indoor places, especially if you're around people that you know are sick. We mentioned children being very commonly impacted by the RSV illness. And we know lots of the ways that it kind of gets back out into the community is it might start with children who bring it home and then pass it on to their loved ones and their grandparents. So if you know that someone's sick, you could be wearing a mask around them, or if you yourself are sick, to help prevent that community transmission, you should be staying home until you're feeling well and you yourself masking if you're able for the days immediately after your illness. And then, of course, covering coughs and sneezes. If you're sick, disposing of tissues properly. All those good standard COVID-19 layers of protection that we've been talking about for a while.
Actually, the kind of things your grandmother or mother probably told you to do, wash your hands, wash your hands, wash your hands.
Yeah, exactly.
And good hygiene when you're using disposable tissues and all that stuff. But it's interesting. I've noticed more people are wearing masks out of choice. And that's really been interesting because I was in a meeting yesterday where someone was wearing a mask and they said, I'm wearing it because I just don't feel well.
Yeah, for sure. And we're talking about RSV here today, of course, but when looking at illness circulation in the community, though we're seeing a bit of a downward swing in RSV, we're seeing continued circulation of COVID-19, increased circulation in influenza. So all these respiratory viruses can kind of impact the body similarly. They spread the same way. So if you are out in the community and like I said, especially around those who are sick, you're in crowded indoor places, wearing a mask might be a good idea for some, especially those at higher risk of those severe complications right now.
Sure. And we want to be very clear, this is a personal choice.
Yeah, for sure. It's based on your own risk assessment, based on yourself, as well as the environment that you're in.
Right. Now, there's no, unlike COVID, there's no over-the-counter test for it, is there?
No. So this one, like I said, would have to be something that your physician would order for you. It's done the same way, but no quick test like the COVID ones, unfortunately.
Sure. Well, Mary, I've got a question for you because you're head of vaccine preventable diseases, which means you look after all the vaccines.
Yes, I do.
And I know from my work with the Board of Health, it was called VPD.
Yes, VPD.
VPD. Mm-hmm. And that actually is a very big program because the flu vaccines and the COVID vaccines, as well as the standard vaccines, all come through your program.
Yep. Mm-hmm.
But what about RSV? There is a vaccine available, but let's talk about the vaccine specifics.
Mm-hmm.
It's a new vaccine, is it not?
Yes, so the RSV vaccine for older adults is new. The infant vaccine has been around for a long time. We do partner up with the hospital for that one, and that program has been running for a long time. But this new vaccine that has come out is called Arexvy. So a little bit difficult to pronounce, XVY. And so it came out on August 4th. So it was authorized for use in Canada on August 4th. The rollout came shortly after. Because of it being a new vaccine, as well as it being the number of doses kind of that are available, the rollout is done in phases. So the vaccine right now, the ministry has authorized for use in adults 65 years of age and older to prevent lower respiratory tract disease that's caused by RSV. And this fall, it was introduced as a publicly funded vaccine for the first time. So certain groups of people are able to get this vaccine for free currently.
What are those groups of people specifically?
Sure. So originally, the first group that was eligible for this vaccine to receive the vaccine for free are individuals who are over 65 or older, living in long-term care homes or elder care lodges or retirement homes that are licensed to provide dementia care. So that list was provided to public health by the Ministry of Health. And then we worked with them to connect them to this vaccine and distribute it. Afterwards, a little bit more eligibility came out. So just recently, those who are over 65 who are transplant recipients, or if they're Indigenous, whether living on the reserve or in an urban setting, those receiving dialysis, or those who are homeless, or those who are in the hospital and receiving an alternate level of care in the hospital. And so all of those groups, as long as they're over 65 years of age, are eligible to get this vaccine for free.
Okay. But that still leaves a large cohort of the population that doesn't get it as part of a vaccine program.
Mm-hmm.
So how's that being handled?
So those groups can actually get this vaccine. So if you feel like you are at risk, you can definitely get this vaccine through your healthcare provider. However, currently it's not a free vaccine. It would be a prescription from your family doctor. And so as more things are learned about this vaccine, more doses become available, the ministry may consider expanding the eligibility later on. But those groups that are not eligible, that don't fall in this eligibility criteria, can go to their healthcare provider and get a prescription for the vaccine.
So let me be a little more clear here. In the vaccine itself, it's not you can purchase it on a prescription basis,
Mm-hmm.
but let's say you've got prescription drug plan
Mm-hmm.
beyond the OD Ontario drug benefit for people over 65,
Mm-hmm.
but it might not be covered.
Yeah,
so you'd be paying the full freight.
Mm-hmm. It really depends on your plan. Just because this is a new vaccine, it might take some organizations some time to get it on their plan. Yeah, so
Right.
you really have to check.
So it's a matter of doing your research and your due diligence around what is available, may or may not be available to you.
Yeah.
Now, is it a one-shot deal? Do you only have to get it once, or is it something like the flu shot you've got to have every year?
So this is actually one of those vaccines that you can get one dose, and the protection it provides is more longer than a year. So um, it's not like the flu shot. So if you get it this year, you don't have to get it again next year. So it provides a longer period of protection. Again, because it is a new vaccine, really determining whether when you should get maybe another dose. It hasn't been determined yet. Currently, the ministry is saying if you're eligible, get your one dose because it will protect you for well beyond a year.
Sure, sure. It's or unlike the COVID vaccine where it's every 6 months at this point, but eventually that'll probably change. We hope. But but then again, that's one of those things that if you're of a certain age, and I'll put up my hand as being of that certain age, I've had more punctures in my arm in vaccinations than you can shake a stick at. So, which leads me to another question. It sounds like it's an effective vaccine. Is it safe?
Yes. So even though it is a new vaccine, it's definitely been studied quite a bit before anything gets authorized in Canada for use. So this is a safe and effective vaccine, and it does reduce the risk of developing RSV-associated lower respiratory tract disease. And studies have shown that this vaccine is over 82% effective in preventing these symptoms.
Sure. So it's kind of like a seatbelt.
Yes. Every vaccine is like a seatbelt. Yeah. It increases your chance of, well, I guess instead of increases protection, I think it might make more sense if I say it decreases your chance of getting the disease. So, and our vaccines are studied quite a bit before anything is released and anything can be used on our citizens. So the effectiveness rate for all our vaccines is very high.
And is this a global vaccine? It's obviously been approved, I know, in the U.S., but is it used in Europe as well?
So I'm not sure about the use in different countries yet. I can speak for Canada. So in Canada, it has been authorized, but we're one of the first provinces to actually roll it out and start using the vaccine. So even though it's been authorized, some provinces are waiting to use it later on. But Ontario has decided that, let's just launch it and get people protected because it's authorized, it's available for us. So yeah, we're one of the first provinces, even within Canada, to start using
it. Ontario has had a long history of progressive public health measures. Our flu shots, our annual flu shots, are a good example of that. I think we were the first to offer flu shots for free for to the whole population in Canada. And I'm thinking you two are probably just a little too young to remember, and you probably never had polio vaccinations or smallpox vaccinations. But I remember them. I remember them. And immunization is one of those things that it's part of life, I guess. One of those things that we that works. And this is one of those additions we can have, certainly. But are there any side effects to the RSV, Mayuri?
Yes. So like any vaccine, you will have some symptoms afterwards. So the RSV vaccine has some side effects, and most cases they're quite mild and shouldn't last more than a few days. So some common side effects, of course, will be pain, where you got the vaccine, maybe some redness and swelling in that area. Also, you might feel a little bit of fatigue or fever, or headache, nausea, Some people do experience a little bit of diarrhea and muscle or joint pain, but again, this shouldn't last more than a few days, and it should be mild. So if you're experiencing anything more than this, or if it's lasting you, a long time, so over a week, then definitely you should consider getting some medical attention.
So that basically there's a few mildly uncomfortable side effects that I hate to say it, are no different than many other vaccinations that we have. And now, correct me if I'm wrong, though those side effects are really our body saying, hey, there's something odd here. We need to respond to that. And that's part of the whole immunization process, because so that when we get the vaccine, we get the bug, the body knows what to do.
Yes, exactly. Yeah, those symptoms really, some people get them and some people don't get any symptoms. I'm sure people have experienced that with their COVID vaccine, whereas for one COVID vaccine, you have all these symptoms, you get your next one, you don't feel anything. But yeah, after you get the vaccine, it is something that's new for your body, right? So it's telling your body, hey, why don't you make a protection mechanism to this new thing that I've added into your body? And so whatever symptoms that we're feeling are a response to that, because it's something that's foreign to the body. And then that way, when you actually get the virus, when you actually get the RSV virus, it's not new to your body. So then it can respond to it quickly and protect you from getting severe illness or any illness at all sometimes.
To be sure. And when you think about it, it all started with smallpox. Jenner and smallpox. That's ancient history, long before my time for sure. But that's basically the whole understanding behind it. But what kind of an uptake are you seeing, Mayuri?
So for the RSV vaccine, we've had some of the eligible facilities, like I said, some of the retirement homes and long-term cares order the vaccine from us. There are still a few that haven't. And in our follow-up, we've just found that in the fall, there's just a lot of vaccines, right? So we have the flu vaccine, the COVID vaccine, and now there's the RSV vaccine. And because the RSV vaccine is a little bit newer, we recommend that it is not administered 14 days. So it's administered 14 days apart from any other vaccine, and we encourage that it's not administered at the same time as any other vaccine. And so because getting that spacing right is difficult, and of course we don't want to immunize someone who's really sick either. And so I'm sure Gillian will have the data on, there are lots of outbreaks and things like that going on. So some of the...
That's my next question, Gillian, so be prepared.
So because of that, some facilities are having a hard time, finding that right time to provide the vaccine. And otherwise, for some of those newer eligibility groups, some of those groups are going to be able to get their vaccine through the hospital. Some of those groups will be getting the vaccine through the clinics that are on our reserves, or they could also go to SOHAC, and then EMS. So the paramedics are also supporting us in some of the vaccine administration to our homeless population. So the challenge is kind of, getting the list ready of the people who are eligible, because sometimes what happens, this eligibility criteria may seem straightforward, but when you're in a real life situation, the hospital has to determine, okay, is this person really eligible or are they not? And so just gathering that information, we're kind of, I think, in the process there. And then once that administration starts for them, it will be very quick. But for the first group that was eligible, a lot of vaccination has already taken place. And on our side, we are planning a few clinics for some groups that were immunizing.
Well, it sounds like it's a very it'll be an ongoing program that will keep the health unit busy for a while. Now, Gillian, what is the situation with respect to RSV today in Grey Bruce? You mentioned there's been one outbreak in a either a long-term care or retirement home setting, but what trends are you seeing?
So pre-COVID, so when we're looking back to our seasons in 2018, 2019, RSV was a pretty key player in our outbreak response work that we do here with public health and the activity that we're seeing in our long-term care and retirement home facilities. However, of course, COVID really changed the game in so many ways. Whereas pre-pandemic, we'd see maybe 40 to 60 outbreaks a year. And looking back at our calendar year of 2023, which is a little different than our respiratory seasons, because as I mentioned, most of the things that we track kind of start in the fall, peak in the winter, and go back down in the spring. So they don't quite line up. We had close to 200 outbreaks in total, half of which were COVID, and just under 10, it looks like, were due to RSV. However, I think when we hear the number 100, it seems hard to fathom compared to 40. So there is ongoing outbreak activity in our local long-term care retirement homes. So though RSV currently seems to be a small player, I think any type of protection or anything that we can throw at just outbreak activity in general to either prevent it or lessen its impact on residents of these homes when it does occur is great. All of our local facilities are doing great work to protect the people that live there. So hopefully this is a tool that makes some of that work a bit easier on them as well.
Sure. And the populations that you've outlined, Mayuri, who are eligible, certainly they're all high risk. They all have a particular set of circumstances and settings. But it sounds like you're getting a handle on it, and it will continue. It will be something that'll be going forward, just one of those ongoing things that is part of the health unit's work and just another part of our daily living. So it's one of those things.
Mm-hmm, exactly. It's because it's a newer vaccine, and just how many doses can we produce for the demand that's out there, right? That's why it's really great that it's being rolled out in phases where, the people that need the most protection, the ministry made them eligible first. And then once most of that population is immunized, I think the eligibility really will all depend on the trends. And the ministry will track that and then determine who should be eligible next.
Gillian, Mayuri, thank you so much for being a part of HealthLink today. We are out of time, and it's been a fascinating conversation about RSV. Thank you both, and thank you, friends, for being a part of HealthLink.
Thank you.
Connect with us by visiting our website or email us at comments@rogerstv.com.
Hi, I'm David Shearman, host of Politically Speaking. Join me for my next show, where my guest will be the Warden of Grey County, Brian Milne. Politically Speaking on Rogers TV.
January 18th on City TV.
Let's get to work.
The wait.
Remember me?
Is over.
Fight fire with fire.
Looks like we're going for a ride.
Law & Order Thursday returns with all new episodes.
NYPD, show me your hands. Don't move.
We're gonna get this guy together, like we always do.
Law & Order, SVU, and Organized Crime. New seasons premiere January